be here and speaking to this select group of people and organization. We're going to talk about knee pain and basically what we do, but the purpose that we are here is because for you guys. So to find out what we do and what's there and as a solution for your knee pain or aches and pains that you have. MedWell is a team of medical doctors, nurse practitioners, chiropractic physicians, and licensed physical therapists. We have two different divisions. Division 1 is non-surgical treatment of spine, knee, and leg pain. We see a lot of patients with disc problems, sciatica, restless legs, neuropathy, knee osteoarthritis, plantar fasciitis, anything lower extremity. We provide non-surgical care through our medical team of physicians, chiropractors, physical therapists, and nurse practitioners. Division 2 is we have physicians who deal with functional medicine. This is kind of a new field. A lot of patients, we call it Center for Chronic Symptoms Recovery. A lot of people, they have sleepless nights, fatigue, hormonal issues. They cannot have an 8-hour sleep, and they are having pain all over their body, thyroid issues, diabetes. We do not cure these symptoms. We help these individuals to be able to feel better with nutrition, dietary changes, and supplements. Many of these patients have been to multiple doctors. Their lab tests are normal. They go to endocrinologist, then they go to their primary care physician, then they go to a gastroenterologist. Their lab test is normal, but they're miserable. So what we do functional evaluation of these patients and help these patients to feel better with natural supplements, drug-free supplements. Who is Dr. Maz? This is Dr. Maz. I'm a practicing doctor at MedWell Non-Surgical Spine and Leg Pain Center, author of internet bestseller book, How to Live Pain Free and Happy, and founder and developer of Maz Method. It's been published in multiple newspapers, magazines, on TV internationally about what we do in the office. We treat multiple politicians and nationally recognized athletes who have reported to us from not only New Jersey, from around the country. We are the healthcare recipient award of 2015 by the New Jersey State. This video is what we do for as a Center for Chronic Condition Recovery. Let me see if I can get this.
Welcome to Focus on Your Health.
Are you tired of being tired? Do you suffer from attention deficit, cloudy thinking, low energy, sleep problems, memory loss, anxiety, or depression? Let's hear Fran's story.
I was diagnosed with thyroid disorder and fibromyalgia. I was desperate, and MedWell Center for Chronic Conditions eliminated my years of frustration and improved the quality of my life.
Hello, I'm Ava Patterson, and thanks for joining us. Why are thyroid conditions becoming such a big problem and so many become prisoner to a lifetime of medication? For answers, we turn to Dr. Maz from MedWell, a center for thyroid and fibromyalgia recovery located in Bergen County, New Jersey. Dr. Maz is a diplomat of the American Association of Integrative Medicine and the author of You Can Beat Thyroid Disorders Naturally. He works with a panel of physicians focused on the recovery of symptoms associated with hypothyroid and fibromyalgia disorder. Dr. Maz, what are some of the symptoms to look for?
Common symptoms include chronic fatigue, sleep difficulty, cloudy thinking, inability to lose weight, memory loss, decreased libido, anxiety or depression.
Why are so many still feeling these symptoms even though they're on medication? I'm one of them.
Ava, medication does not fix the cause. We detect and address the underlying cause of patients' chronic condition that is often misdiagnosed or not effectively addressed with drugs or blood work.
How is your approach different?
Well, thyroid disorder, fibromyalgia, or other chronic conditions affect every cell in your body.
What are some typical results your patients experience?
Increased energy, restful sleep, weight loss, clarity, better moods and focus, and hair regrowth.
That's amazing. Thank you so much for being with us. Today, Dr. Maz is offering to the first 25 callers who qualify a complimentary consultation valued at $250.
They have multiple DVDs about different conditions. These are not the only DVDs. These are my life's work. Past 10 years of latest research about neuropathy and restless legs. MAS method for biostructural correction. You come into the office with a faulty posture, forward neck, slouch posture, you leave better. If you don't leave better, you don't pay. That's almost guaranteed. We have never had a patient who comes in and did not leave the office with a better posture. Secrets for diabetes recovery. Again, it's not a cure. It's gonna help your symptoms. It's gonna help your blood sugar fluctuations, which is not being handled by medication. Why do I feel like this? The 2-minute video talked about that. The people who have fatigue, anxiety, insomnia, low energy, mood swings, skin problems, a lot of these, they have a neurological component and metabolic component. You need to go to a doctor who understands neurological aspect of it and metabolic aspects of it. Test you neurologically and metabolically and gives you supplements for metabolic and neurological component of the condition. Fibromyalgia and chronic fatigue. Many people who are fatigued all day, they say, oh, I have chronic fatigue. They have pain all over, I have fibromyalgia. It's an easy diagnosis that many people, unfortunately, are labeled as having. Many of these conditions, especially the fibromyalgia, is not a muscle problem. It is a neurological problem where with oxygen treatment in our office, we help these individuals and, again, supplements and natural remedies. Oxygen treatment, we talked about it. Neck and back pain. We have licensed physical therapists, chiropractors, and medical doctors that assess your back pain, and we give you, by the way, there are some injections that is done in the office that are homeopathic. There is no cortisone in these injections, and they work better than cortisone. We have many patients, almost every day, patients come to our office, they have had epidural, they have had surgery. They get to our office and they get non-steroidal anti-inflammatory medication. Some of you have been to the office already before, and they can vouch for that. Today we are talking about knee arthritis recovery. This is not about me, as I said. This program is about you guys. By the way, after 8:30, I'm going to be here if you guys have any questions. Who's suffering from knee pain over here? Raise your hand. Okay. Who is affected by knee pain? Young adults, elderly, dancers, runners, amateur and professional athletes. This is a patient who came to our office from a far distance.
My name is Sue. I come from Long Island. I want to thank the MedWell staff for a phenomenal improvement. I came here not being able to walk stairs, not being able to go food shopping, with the assistance of the staff, and now I'm taking my first Reflexa shot. My knee is improved tremendously.
Because we don't have time, we just have to skip that. Many of you are diagnosed or you feel you're bone on bone. The knees are not working. You go to doctors, basically this is a bad knee, this is a good knee. You don't have any cushioning. As a result of not having cushioning, you're gonna have pain, you're gonna have inflammation, you're gonna have swelling. This is what you're supposed to have. You need to have cushioning between your knee. You go to the doctor, common diagnoses: chondromalacia, runner's knee, patellofemoral syndrome, knee osteoarthritis, degenerative joint disease. These are all basically saying bone on bone, you have knee problem. Why does knee pain affect you? Because whatever you do, it is affected by your knee. You play your favorite sport, walking, exercising, running. Anything that you do affects your knee. We're going to skip this video due to time. What's happening over here is if you go up the stairs, you feel like your knees are giving away. It's not yours. You have to always put a brace on. You hear cracking sound of your knee. This is another patient. Let's see if you can watch seconds of this.
My name is Jay Potter. I'm from Monmore, New Jersey, which is exit 25 on the Garden State Parkway. I've had knee pain for about 2 years now. I've seen other doctors in other facilities and nothing was working. I read about MedWell in New Jersey Fire EMS magazine. I'm a full-time paramedic firefighter, so obviously I'm on my knees all the time. So I started coming up here. It's a long travel, but it's made a world of difference. I'm in week 3 now of a 5 to 8 week therapy, and I can see a difference. I can start to.
He was scheduled for surgery, canceled surgery. So if you have difficulty squatting, kneeling, bending, walking, you need to get evaluated. So how are we going to get rid of this painful problem that's affecting your life? That's why we are here. I'm thrilled and excited to have a solution for this. Imagine being able to be active again, climb stairs, squat, bend, walk without knee problem. So what we need to do, we need to decrease the amount of pain that you have. Decrease swelling and inflammation, and increase cushioning of your knees. That's what needs to be done. This is, we take care of a lot of law enforcement officers and personnel because they're on their feet all day long. They have the weight of the belt and they stand all day, and it causes them to have knee problem and leg pain. This is Bergen County Sheriff Michael
Sheriff
Sordino.
Michael Sordino, Bergen County Sheriff, and I'm here this morning to thank Dr. Maz and the whole MedWell staff for all they do. Hi, I'm State County Sheriff Richard Burdick, and I encourage everyone to come to MedWell. The treatment here is fantastic, the staff is wonderful, and if you want to get better, this is the place to be.
MedWell is your one-stop medical center for all your healthcare needs with sports medicine, physical therapy, chiropractic care, and diagnostic studies and one-on-one treatment, which is second to none.
How long did it take you to mess up your knees and become like this? Weeks, months, or years? Years. Exactly. So if your current medication or treatment was working, you would have been fixed by now. If you start treatment now, you will have a better chance to respond quickly with less chance to go under the knife for having surgery. And when you follow our protocol, your medication, you may eliminate it or go down drastically. So you can regain function. First thing that we need to do when you come to our office, we take standing x-ray. Standing x-ray is very important. A lot of times people go to doctors, they get laying down x-ray. They lie down on a table, they take x-ray. Well, you don't have pain when you're lying down. You have pain when you're standing. So that's very important to be done. You gotta skip this one. Next is the medication that is given. Cortisone has a lot of side effects. You want to avoid cortisone as much as possible. We provide a medication that's covered by most insurance plans, including Medicare. It's called Hyaluronic. Hyaluronic is a gel-like substance. It cushions in your knees because it mimics the synovial fluid in your knees and reduces inflammation immediately. So it basically oils up your knee with zero side effect. Common mistakes is you get cortisone, Cialis, Rotary, or other medication that is provided. This person
Hi, my name is Inge Ofrayes. This is my 8th visit. I was very, very incapacitated, and after the first visit, I knew I was getting better. And I have been getting help, and I walk better, I have less pain.
Very big mistake. A lot of you guys have been to doctors, have had the injections, but there was no imaging guidance. Imaging guidance is very important. What that is, we do have a video x-ray, not a static x-ray, video x-ray, so we know where the medication is going in your knees. So we don't blindfold and just do the injection and say you didn't respond, you need surgery. So we see a video of where the medication is going for accuracy purposes. These shots, along with physical therapy and laser treatment, they work hand in hand. You have to have the exercise, which we do on-site, and physical therapy. So what are you waiting for? How do you think you're going to feel a year from now if you don't do anything about this? How do you think you're going to feel 3 years from now? Better, same, or worse? How do you think you're going to feel 5 years from now? Okay, so the best time to do something about this is now. We have a 100% guarantee that if you don't get better, we don't charge you for laser treatment. This is another guy. We skipped him. I want to introduce you our medical director, Dr. Shahab. He's the medical director of the center. He's also a mentor of mine. He works side by side with me and developed this program. We are both passionate to help people and helping individuals who are in pain and to get rid of their symptoms. This is my family. I want to always introduce my family to everyone. We are here, as I said, you guys are all here to help people to have a better life. We are also we have the same passion of helping people. Let's get this patient. And the next step is, how do I know if I'm a candidate for this therapy? Let's find out. First, you need to fill out a questionnaire when you come to the office. Then you're going to visit one of our doctors for consultation and standing x-ray. Once you're accepted as a patient, because we don't accept everyone as a patient, if we feel we can help you, we accept you. If we feel we cannot help you, we don't accept you. Some of our patients, they get in-house TENS unit provided to them for therapy at home. So the days that are in the office, they get therapy. The days that are home, they can use some therapy also to strengthen their muscles. We guarantee our work. If you don't get better, we don't charge you for the laser treatment. That is done in the office. And this is me waiting for you on top of the building. Make your appointment today and receive a copy of my book, a copy of my Life's Work DVD, the knee arthritis recovery, and we can set up an appointment for you. And all set. I'm done on time.
You did well. Thank you very much. Any quick question, just for a minute or two, question, and then we'll do the 50. Yeah.
Yes.
Can you treat spinal stenosis?
Yes. We have a specialized table called a spinal decompression table that stretches your back to get the pressure off the nerve. By the way, can we guarantee it? No. So it gets the pressure off the nerve. When we get the pressure off the nerve, we do physical therapy with licensed physical therapists to stretch the tight muscles, strengthen the weak muscles, so the spine stays the way it is. Good. Next question.
I have a 20 ACL torn meniscus and arthritis. So you're saying you're not saying you could avoid an ACL surgery by what you're doing?
Directly, I don't say that. Indirectly, yes, I do say that. The reason for that is because we have to see why you're having the symptoms that you're having. What's causing the pain and the inflammation? If it's more arthritic, or if you torn your ACL first, now you have arthritis. Regardless, you need to go through this, because if you don't take care of this, you're going to have more arthritis. Okay? And if arthritis caused all of this, you need to get this anyway. And it's kind of a no-brainer because it has zero side effects, covered by most insurance plans, and it works. We have young dancers, we have people in their 20s or 30s, they come to our office for this treatment. Next question.
Thank you.
You're welcome. Yes?
So if somebody came to you for knee pain, how many times a week and what's the length of the treatment?
There is 2 programs. Program 1, which is the program that we advise, because a lot of people, they come from far distance, 2 hours, 3 hours, 4 hours drive to come to our office. So for them, we want them to come once a week for 5 weeks to get the shot, and they get physical therapy close to their home. For people who are locally over here, they come 3 times a week, ideally. 3 times a week for 5 to 7 weeks. They get all 3 visits, they get physical therapy. 1 out of the 3 visits, they get a shot in the knee as well, if they have bilateral knee pain, both knees. They, for example, if they come Monday, Wednesday, Friday, they get Monday, Wednesday, Friday physical therapy. Monday, they get an injection to the right knee. Wednesday, they get an injection to the left knee. Friday, they just get physical therapy for 5 to 7 weeks. Yes?
Do you have physical therapists in your office?
We have 7 licensed physical therapists in the office.
And where are you located?
Midland Park by Rosario's and Arturo's restaurants, about 5 minutes from here. Yes? And Dee and Joey, they're here to help you if you have any other questions about the location, so on and so forth. Yes?
Thank you very much.
Thank you.
Appreciate it. And give you an applause.